I think what is unique about Deborah's approach to clinical research is that she doesn't just undertake a study. She undertakes all of the ancillary work that needs to be done to conduct a study, and beyond that, she studies the process of doing a study.
In the intensive care unit, we may and we should talk to our patients, but often they are in a coma related to their condition or because of the drugs that they're receiving. So the people with whom we interact more than the patients are the family members. They bring personhood and a sense of humanity to the ICU. And it's our job as interprofessional clinicians in the ICU to recognize our shared humanity. And families are absolutely indispensable in that regard.
I'll never forget the first time I met Deborah Cook. I walked into the ICU and I saw a woman in full protective gear telling them, "Hi, I'm Dr. Cook. I'm going to be taking care of you." And I remember looking at one of the nurses being floored, like, wow, not many doctors take the time for patients who are, intubated and sedated to introduce themselves, to show that kindness, that human touch. And there's Deborah Cook just at the bedside with every patient, making sure she gets that connection.
Deborah led a whole package of work to try to understand the ethics and the practicalities of co-enrolling patients in multiple studies. And that's now really become the norm for critical care trials, is to include patients in multiple studies if at all possible. She is innovative in thinking about how we do research and how we measure what we do, how we understand the process of research, as well as the question that we're asking.
So I was fortunate to work with Dr. Cook to see what she had done in establishing the Canadian Critical Care Trials Group, and not needing to reinvent the wheel because Deborah had already done the work and had a perfect model. We used that model to establish our own group with a little bit of an Australian influence to it.
And even though I would say Deborah Cook is probably most known for, leading the Canadian Critical Care Trials Network, leading these global studies looking at interventions in ICU settings, I would say probably her most important work that I connected the most to is her work with 3 wishes.
Wishes of dying patients from themselves, or wishes that the families may bring forward on behalf of the patient, wishes that clinicians may have, manifest often in simple acts of kindness, playing special music in the room, bringing in the family pet, having a taste of cappuccino under someone's tongue. The wishes are simple.
I think Deborah's just a fantastic role model. You can't help but pick up that this is just that generosity of spirit. And that really has extended throughout our research culture here. And having that culture of collaboration around research extends into a collaboration into how we treat patients.
Empathy may be invisible. Acts of compassion, by definition, are more evident. And I'm hoping that part of critical care will be sustained in the future.
I want to be like her. I want to be her. Not just inspiring because of what she's accomplished as a scientist or a clinician, but just as a person. She's a good friend. She's a good mentor. She's a loving human.
Seminal critical care researcher, advancing evidence-based intensive care worldwide. Co-founder of Canadian Critical Care Trials Group. Canadian Medical Hall of Fame laureate, Dr. Deborah Cook.